First step, we need to apply numbing cream before operation. The numbing cream shouldn't stay on the skin for too long. If stay too long, the patient may get burned. Normally, we suggest 20 to 30 minutes. You can apply the numbing cream a little bit thicker so it works better. After applying the numbing cream, we need to put a plastic wrap on it. You can also operate on the nose and the area around the lips. Neck wrinkles can also be treated by this RF microneedling treatment, but try not to touch Adam's apple and trachea. If you want to treat those two areas, try not to go too deep. In this video, we only show treatment on the face. Now the face is properly numbed, we take off the plastic wrap and remove the cream. After removing all the cream, we need to disinfect the face with iodopher. Now we use the cotton pads to swipe the face. Use another cotton pad for the other side of the face. After the disinfection with iodopher, we need to clean up the face with saline. Clean the face until you couldn't see any color of the iodopher on the cotton pads. If the patient has sensitive skin, we can do this by pressing instead of wiping. After cleaning up, we let the skin to dry out a little bit. Then we can start the microneedling. Now we start by installing a new needle tip. Make sure it's properly sealed before opening because this is medical sterile, so one patient, one needle tip. Now we start the operation. We are going to do anti-aging and acne scar removal, so we are going to microneedle 3 times over the face. For example, on the cheeks, we microneedle on 1.8 mm for the first round. For the second round, we microneedle 1.2 to 1.5 mm. And for the third time, we microneedle 0.8 to 1 mm depth. Now we start on the jawline. We are on auto mode, so we just wait for the needle tip to suck on the skin, then lift up the handle a little bit. Meanwhile, needles come out automatically. You'll find there's a gap between the sides of the needle tip and the needles, so you can overlap on the areas. Otherwise, you might find you didn't cover all the area. You might want to wait for the vacuum pressure to come up until you go on the next shot. Although this is the invasive needle, there will be basically no bleeding because the releases of radiofrequency energy offer immediate solidification, so blood solidified under the skin before it bleeds out. We can see there's an acne here on patient's face, so it might hurt a little bit. Now we set a shallower needle depth to treat skin around the eyes. We set it on 1.1 mm. Be careful here because we don't want to treat on the eyeballs. If the tip does not grip easily on the forehead, we can tilt right and left a bit. Only when the tip grips on the skin, needle will come out. Now we are about to finish the first round on half of the face. We can continue on second round of needling. In this video, we only demonstrate on half face. On second round, we set needle depth to a smaller number. We are going to set on 1.4 mm. Now check on patient's face and we can see there's gap between two shots. So on second round, we can focus needling on the gap. So all the skin will be covered. So after all the needling, we use normal saline to soak the face right after. Then we apply sterile moisturizing mask. Cooling products are optional, but careful not to be too cool. Remember to apply moisturizer every day after treatment for 7 to 10 days.